Examination of the hands. The hands can give you information about patient health. Shaking hands with your patient will tell you about many systemic diseases, but remember, some patients are not comfortable with physical contact. As with any examination, Hance examination begins with your introduction, consent to examine, position of patient, and also ask about pain or tender areas. Particularly to Hance examination, expose your patient's arm. Ask him to rest their arm on pillow. Tell him about the procedure. What are you going to do? Then, starts with inspecting the skin, muscles and joints of both surfaces of the hand, that is palmar and dorsal surface. After inspection, check movement and feel each joint. Our inspection begins with skin. Color of skin provides information about pigmentation, jaundice and palmar erythema. If consistency of the hand is tight, which suggests scleroderma, and if thick, which may suggest diabetes or acromegaly. Check for characteristic lesion, which include rashes, purpura, spider nevi, tarfi, and scars. Lastly, look for any swelling or deformity. On inspection of muscles, examine muscles for wasting and fasciculations. On palm, look particularly at thenar and hypothenar eminences. Look for dopteroang contracture, and perform Tinel's test. If tingling occurs, which may suggest carpal tunnel syndrome. Wasting of thenar eminence. Look like this. Have a look at dopteroang contracture. In joints, check for acute inflammation. See if there is any swollen or red joint, and characteristics deformity of chronic arthritis, which we discuss later. On dorsal surface, look for the same skin changes as the palm. Look for tendon xanthomas and joint replacement scars. Looking at the nails can give you information about many systemic diseases, which we are going to discuss one by one. First one is koilonychia, in other words spoon-shaped nails, which suggest many diseases, which include iron deficiency, hemochromatosis, fungal infection, and endocrine diseases. Onycholysis, which means detachment of nail from nail bed, is seen in hypothyroidism, fungal infection, and psoriasis. Pitting nails, seen in psoriasis, and alopecia areata. Splinter hemorrhages are fine longitudinal hemorrhagic streaks which are present under nails. In febrile patient, may suggest infective endocarditis. Nail fold, infects, embolic phenomena, seen in vasculitis disorder. Chronic paronychia, infection of nail fold present is painful swollen nail, with intermittent discharge. Clubbing is significant part of nails examination. It is defined as increased curvature of nails in all direction. Any disruption to normal pulmonary circulation which may occur in inflammation, cancer, or in right to left shunting allow large megakaryocytes in circulation. They become lodged in capillaries of nails and toes and release platelet-derived growth factor and vascular endothelial growth factor, which cause clubbing. Its causes are bronchial cancer, emphysema, lung abscess, bronchiectasis and cystic fibrosis, TB, cyanotic heart diseases, endocarditis, inflammatory bowel disease, and cirrhosis. When inspecting the dorsal surface, examine the joints for characteristic deformities, which include swan neck and Bettina deformity which present in rheumatoid arthritis. Also look for Hebden's node and Bouchard's node, which may be seen in osteoarthritis. Okay, at this point our inspection ends here, and now we move on the next part of examination. After inspecting skin, muscles, and joints, assess neurological function, look at power, function, and sensation. Starting from wrist and forearm, Ask patient to flex and extend his wrist joint. Then look at supination and pronation. Power of hand muscles is checked by following procedure. Ask patient to squeeze my 2 fingers. This allow you check pincer grip. Then ask patient to spread his fingers, so you can assess adduction of thumb and fingers. Adduction of fingers checked by grip, piece of paper between his fingers. Function of the hand examined by asking your patient to write a sentence, undo a button, or pick up a coin. While checking sensation, check both light touch and pinprick on little finger, which is supplied by ulnar nerve. Index finger, so you can check median nerve. And lastly, anatomical snuff box, which assess radial nerve. After checking sensation, examine each joint, palpating for tenderness, effusions and crepitus. So here examination of hand ends.
Thanks for watching. For more videos, please subscribe to our channel OAS Design.